Hi guys, I hope you're ready for your first lecture slideshow in our module 151. So in case you don't know, or I probably haven't told you, but today, Monday, the 1st of June, we're actually starting module 151. It's a whole new module. Welcome back, Alexis. Alexis is back off of LOA. So I want to talk about the two editions. I want to give you some key things that I think you need to know about this particular book. I would like for, if you have the 14th edition, I'd like for you to turn to page 26. And if you have the 13th edition, turn to page 30. And you're going to see it's all in purple. Oops, all in purple. And what this is this is a summary of learning objectives. So this is the questions that I asked you to answer that's at the very beginning of your chapter, right above your key terms. And it's going to be like that in every chapter, those little questions. These are really the answers to those questions. This is the most pertinent information that you're going to find in your chapter. Now, does that mean you do not need to read your chapter? Absolutely not. But if you want to go into your chapter and read and highlight and everything, and then you're getting ready to study for your test, it's a good thing to be able to go through and, just refresh your memory. Also, I would like for you to pay attention to, again, it's 26, 14, 30, 13, professional behaviors. It's in an orange box. There are all kinds of different colored boxes. There are critical thinking applications, there's little blue boxes, there's all different colors. I want you to pay close attention to some of those. Now, am I going to be having you do all of those all the time? No, I may just actually assign one or two of those things as we go along into the book. But those little boxes are going to be lots of great information, lots of practicing. So, okay, without further ado, I'm just going to go straight into the slideshow. So let me share the screen. Okay, so the name of our chapter, whether it's 1 or chapter 2, is the professional medical assistant and their healthcare team. Responsibilities of the medical assistant. Clinical skills include assisting during a physical exam, performing patient screening procedures, performing ECGs, phlebotomy, first aid procedures, and infection control procedures. Okay, I want to point something out. If you're a medical assistant, which you know the other Miss Marcia teaches medical assisting, and what I do is I teach, it's like AMA, administrative medical assisting. Are you going to be doing these things? Is it within your scope of practice? Well, most of these things are not in your scope of practice. But in this particular chapter, it crosses over a lot. And so we'll be pointing out things of, okay, this isn't in your scope of practice, or this is in your scope of practice. Here we go with administrative skills. This is what your administrative skills are going to include: answering the telephone, managing patient scheduling, documenting accurately in patient health records, managing facility correspondence, and following legal and ethical principles. Okay, so we're going to talk about patient navigator. What is a patient navigator? It's a person who helps guide a patient through the healthcare system. This includes help going through the screening, diagnosis, treatment, and follow-up of a medical condition, such as cancer. A patient navigator helps patients communicate with their healthcare providers so they get the information they need to make decisions about their healthcare. Patient navigators may also help patients set up appointments for doctor's visits and medical tests and get financial, legal, and social support. They may also work with insurance companies, employers, case managers, lawyers, and others who may have an effect on a patient's healthcare needs. They're also called a patient advocate. The role of a patient navigator. Medical assistants also play a role as the patient's advocate. Care coordination originated from patient navigator program and patient navigator positions are commonly called care coordinators. Positions can be found in ambulatory care settings and hospitals. Okay, so let's talk about customer service. So we have gone over this a little bit, but just because they're your patient doesn't mean they're not your customer. They are your customer. It's the same as if you were working the customer service desk at Walmart. Although your care of that customer is different, the service should be the same. Customer service closely relates to professional behaviors. Great customer service leads to a successful healthcare facility and allows growth. The goal should be to provide customer satisfaction. Patients are considered external customers. Characteristics of professional medical assistants. Professionalism, courtesy and respect, empathy and compassion, tact and diplomacy, respect for individual diversity, honesty, dependability, and responsibility, and professional appearance. There is no single definition of the scope of practice for medical assistants throughout the United States. And we're going to get into a little bit about the scope of practice, and I'm going to give you an example. But let's move on just a little bit before we do that. Scope of practice and standards of care for medical assistants. Scope of practice, range of responsibilities and practice guidelines that determine boundaries within a healthcare worker's practices. Medical assistants are not independent practitioners. So let's just talk about, I'm going to talk about one of our students that just recently left. She went on a job interview last week. And one of the positions that she's looking at is medical billing and coding and some front desk work. But the doctor also said, but I also want to cross-train you to take vitals. So if you're needed in that area, you can do that. So if I went into a facility right now, just me, and they automatically needed me or wanted me to take vitals, that would be out of my scope of practice because I've not done that in years and I don't have the training. But for Kelly, who went in for that interview and the doctor says, I'm going to train you, it is no longer out of her scope of practice because she feels comfortable. She's agreed to the doctor that she will go and do those duties if needed. And she has the training and the capability to do so. So that's what your scope of practice is going to be. Now, I've learned how to do venipunctures a little bit as I've been teaching NBC just because I was interested. And if I go into a facility and I tell them, oh yeah, I'm trained for this, and I actually hurt a patient, that is on the doctor. Well, it's on me too because I have claimed to have an ability or expertise at something I don't because it's out of my scope of practice. Guys, you have to be careful. Make sure that you stay within your scope of practice. Medical assistants not meeting expected standards of care may be charged with professional negligence. Standard of care is a legal term that refers to whether a level of quality of patient service is same as what another healthcare worker with similar training and experience in a similar situation would provide. Okay, so now we're going to talk about some professional organizations. You need to know these abbreviations. The AAMA, American Association of Medical Assistants, AMT, the American Medical Technologist, and the NHA, National Healthcare Association. Not involved in program curriculum standards or program accreditation. Okay, so this gives us a few more. The AAMA is the only association devoted exclusively to the medical assisting profession. Only graduates from CAAHEP, accredited or accrediting Bureau of Health Education schools, accredited schools can sit for the national certification examination to become certified medical assistants. AMT was founded in 1939 and is a national recognized certification agency for multiple allied health professionals. And the NHA was established in 1990 to offer examinations in a number of allied health programs. Okay, achieving a credential in continuing education. Being a credentialed medical assistant has certain benefits, and we're going to lead that into being a certified medical biller or coder has certain benefits. And it's important to stay current with the newest medication, treatments, and diagnostic tests. Continuing education options, Continuing education options include reading professional journals, reputable health websites, on-the-job educational conferences, local, state, and national medical assistant conferences. Okay, I'm going to expand on that a little bit for medical billing and coding. Okay, you finished the program, you've taken your medical billing and coding test, and you passed, so you're going to get certified. So they give you your certification. They are not going to say, here you go, and see you when I see you. No. You're going to have to do through the year a certain amount of continuing education because you have to stay up to date. For example, right now, in order to keep, I'm just going to use Miss Kim in the evening. She recently had to do a COVID-19 little education. So she got the education, she read it, or she watched the videos, and she took a little quiz, and that went towards her hours on keeping her certification up to date. Certifications are not just given to you and forgotten. You have to maintain those certifications, and there are certain guidelines in doing so. How are you going to know? Well, because in the NCCT company, it's going to let you know what you need to do. Okay, we're going to talk a little bit about the history of medicine. Hippocrates is known as the father of medicine. Oh my goodness, I'm so tongue-tied, I'm so sorry. He actually wrote the Hippocratic Oath, and doctors, nurses, medical field personnel still take the Hippocratic Oath. In 17th century, European academics and our societies were established. Gradually, administrative part of running a practice became time-consuming and complicated, so physicians realized they needed help. The first medical assistants started working in individual physicians' offices with on-the-job training. Now, can you get on-the-job training and get these types of jobs? Absolutely. But now they really love for you to have the education to back up that day-to-day training, and it just puts you a step above the rest. Medical professionals. They can be doctors of medicine, doctors of osteopathy, chiropractic doctors, hospitalists, nurse practitioners, and physician assistants. Okay, I am not going to read through all of these. I'm going to make you have the information. You can pause the video and read this. But it's just giving you a definition of each one of those jobs. Allied health professionals loosely refers to those who can act only under the authority of a licensed medical practitioner, and they fall into two broad categories: technicians or assistants, and therapists. Allied health professionals typically work as part of a healthcare team, which is what you will do as a professional medical assistant or administrative medical assistant. There are different types of healthcare facilities. Okay, guys, you are going to know what most of these things are, but we're just going to go through them. So hospitals, primary, secondary, and tertiary level of care. And there's ambulatory care, which are physicians' offices, group practices, multi-specialty group practices, and other healthcare facilities such as diagnostic laboratories, home health agencies, or hospital-affiliated home healthcare organizations. So now we're going to talk about PCMH, which is patient-centered medical home. Patient care is looked at from a holistic approach. Research indicates that PCMHs are saving money by reducing hospital and ED visits while at the same time improving patient outcomes. The goal of the PCMH is to improve patient outcomes and reduce costs. So there's a model of patient care, and the 5 core functions and attributes: comprehensive care, patient-centered care, coordinated care, accessibility service, and quality and safety. I don't know why my last one doesn't have the cute little O with the slash through it, but there you go. Let's talk about professionalism. Again, we've spoken at length on professionalism, and we will continue until the day you're not in school. That's how important professionalism is in the medical community. Having a courteous, conscientious, and respectful approach to all interactions and situations in the workplace. You have to have work ethics, composed set of values based on hard work and diligence, and all employees must be punctual every day. So right now, you guys have it pretty easy. Some of you know me really, really well. Some of you haven't gotten the benefit of being in the classroom yet, but it's coming soon, I know. One of the things you will find out about me is I expect for you to treat class exactly the way that you would treat your job. Because while you're going to school, that is your primary employment to me. So, do I accept lateness in class? I do not. Do things happen? Yes, they do. You contact me? Okay. Things don't happen every day. Things don't happen every week. So, my expectation as your instructor is that you'll be at class punctual, on time, daily, whenever possible. And to me, at the end of the program, and you've done all you can do to be there as much as you can, that you've been punctual, you've been on time, you've been professional, you've been courteous, you've been respectful, your ethics and values are very apparent, that makes me comfortable enough to go to Ms. Shana, the career services lady, and say, okay, this is Josette, I'm going to use you. Josette has exhibited these things in class, A, B, C, D, E, F, G. And I want to be able to give her all of those things. Yes, we want to attach Unitech's name to Josette. Yes, she's going to go and she's going to represent my program, and she's going to represent herself, and she's going to represent Unitech in the proper way. Now, you don't come to class, you're late every day, you don't apply yourself to work. I'm not going to take that personal step and go to Miss Shana and say, okay, so-and-so, I'm not even going to call a name, I can't think of one else, so-and-so, she didn't show up at class, and she wasn't punctual, and she just barely got by, and she was very disrespectful and disruptive. But, you know, go ahead and say that Miss Marcia, you know, sent her to you, and that, you know, attach Unitech's name. No, 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 no. You have to treat your school career exactly the way that you would treat your professional career. You have to begin to practice those things in which you plan to go forward. Be punctual, be respectful. There's always areas we need to work on, and so let's start working on those things now. Do that personal inventory and begin to work on the areas that you feel you lack. Cooperation and willingness to help. Each team member must be willing to cooperate and help others on the team. Guys, we have that in spades in our class. How awesome is that? Through cooperation, team is more productive. Team members have greater satisfaction, great sense of communication and understanding as a team. Patients are cared for, and great customer service is provided. Now, I'm just looking back on all the times that we were in class and someone was having trouble, and you know, I don't even have to make a step forward, because one of the senior students or one of the students who understands it well automatically goes and says, oh, I'll come sit with you and we'll work together. When I tell you guys that depend on each other, work together, work as a team, lift each other up, it's not because I'm happy to see it. Well, of course I am, I love that. But also because you carry that wherever you go to work, and that is invaluable. Teaches you to be a team leader. Even being on a team with someone that you don't particularly personally like, but because you're a professional, it doesn't matter. You can still be cooperative, kind, and act as a team member with that person. Prioritizing and time management skills. Methods that maximize personal efficiencies and prioritize tasks. Take 10 minutes to write down the tasks for the day. Keep it manageable. Use a code system to prioritize tasks. Okay, you need to remember this because it is on the NCCT test. M is a must be done that day. The S is the should be done that day. And C is could be done if time permits. I am going to grab, I have a to-do list going every single day. When I don't have a to-do list, I think it's because I'm a little older, I forget. I go off on a tangent, or I forget. I don't prioritize my day the way that I need to. So this is so important. If you're not a list maker and you're not an organizer by nature, we're going to work on that, because as a coder, I had to be organized. And we'll be talking about that through your course. Those of you who are ending, you know that you've heard it so many times. Prioritize, organize, and use your management strategies. Responding to criticism. Okay, this is a hard one for everybody, but we learn from others' feedback on our performance. We need to realize value of feedback, and becoming defensive or blaming others is not professional. Okay, so I'm going to just tell a quick story. I'm trying to think of which one I want to tell, because believe it or not, I'm not perfect and I have had to accept criticism. I'm just going to tell you, when I became a teacher at Unitech, and I was very, very brand new, and I was becoming way too emotionally involved in certain situations with students and things like that, because I hadn't learned yet how to separate that. It was a very new experience for me. And I had to be talked to about, you know, there's a line. You can't cross the line. You can't become overly involved or overly caring or get yourself past the line of where you're supposed to be. That was very hard for me to hear, because all I thought is I was caring. Excuse me. And that's true. I was just caring, but I was going past what my professionalism called for. And I needed the feedback from my boss. Sometimes when I have to talk to you guys and I have to say things like, you know what, you're not giving me your best work. It's not because I'm just trying to knock you down. I'm just making you understand the expectation, and because I know you can do better. So criticism can be difficult, but it also can be valuable, and you can turn that criticism into another confidence that you have where you can grow. Problem solving and chain of command. It's best to talk with the person whom you are having an issue. Refrain from using sentences that start with "you are," and remove the emotion from the situation. If issue is related to death, confidentiality, or harassment, you may need to follow chain of command in the healthcare facility. Okay, so let's talk about, okay, so I am a front desk receptionist, and I am responsible, my primary responsibility is to make appointments and to answer the phone. But when I have so much going on, my backup person, let's say she is the insurance authorization lady. Okay, so I'm at my day of work, and over and over and over again during the day, let's say from 10 to 11 is the busiest time of the day, and she's supposed to be on alert for me during those hours to help back me up to answer the phone, but she won't do it. She's not helping. So do I need to go to the manager, the first thing, the facility manager, and say, okay, Betty back here will not help me answer the phone and blah, blah. No, first of all, thing you need to do is say, okay, Miss Betty, let me make sure that I have this clear because I'm having a little bit of issue between 11 o'clock. Are you supposed to back me up during those times? And if she says yes, say, okay, well, I've just been noticing that during that time, the phone is ringing, ringing, and ringing. What do we need to do to solve this problem? So you go in and say, okay, we have a problem. Let's solve it together. You don't go in and say, you are lazy and you won't help and you're this, that, and you're this, that. No, that's very accusatory. You want to do it professionally. You want to go in with, this is the problem. Let me make sure that I understand what the solution was supposed to be for the beginning. Okay, maybe I've misunderstood. And then you go into, okay, well, we still have a problem. Let's find the solution together. I hope that makes sense. And then your chain of command, you know, my chain of command, there's me, and then I have my boss, and then my boss's boss, and then my boss's 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 boss, you know, it goes all the way up. So where do I go when I have an issue? Well, I go follow the chain of command. I go to my boss. And then she may go to her boss, and it may go up from there, but that's the chain of command that I have to follow. Where do you guys fall? Well, you come to me. I can't solve the problem, then we go to Miss Chrissy, and then so on and so forth. You follow the chain of command. Barriers to professionalism can be attitude, procrastination, personal problems and baggage, gossip, personal communication, and dating coworkers. So let's try to take any of those barriers down when we can. We don't need any help making things difficult. Self-boundaries. It's important to develop a solid professional relationship with your patients. Establish realistic self-boundaries and protect relationships. Now, I'm just going to go back to when I was a new teacher and I had to hear the criticism of I get too emotionally involved. There have to be boundaries that can protect me, that can protect you, and that can protect the relationships in between. So we're just going to watch a quick little video just to kind of solidify some of the things that we just talked about and to kind of give you a little bit different way of looking at it.
Healthcare setting and the healthcare team. Ambulatory care setting. Individual and group medical practices. The individual practice, also called your solo practitioner. One primary care physician sees and treats patients. One provider is responsible for all the costs. Individual and group medical practices. A group practice has 2 or more providers that share the costs. The providers can consult each other. The patients may request the same provider for all appointments. It ensures there is always a provider on call. About 68% of providers practice in a group such as this. You have urgent care centers, usually private, and they are for-profit centers. They provide primary care, treat routine injuries and illnesses, and perform minor surgeries. Sometimes an urgent care facility can be used instead of going to a ER for a minor emergency. Providers are often salaried employees. They see higher volume of patients, usually for a lower cost than a hospital emergency room. Managed care organizations, health maintenance organizations, HMOs, provide a full range of services under one roof. We have PPOs, Preferred Provider Organization, is a physician's network. And you have independent physician associations, IPAs, treats patients for an agreed upon fee. Boutique and concierge medical practice. Sought by patients, discouraged with insurance reimbursement. Provides immediate access to provider for 24/7. Convenient, unhurried appointments. They have unlimited access to emails, fax, phone, and consultations. They can do home or work visits as needed. Coordination of any specialist referrals. And there's a set fee for services required for an exclusive service. These are usually fairly expensive services. You'll see this more in your large cities and your more upscale, richer communities. The healthcare team includes your primary care physician, specialists, and all the allied health professionals. The title doctor. A physician has a degree of Doctor of Medicine, MD. There are other medical degrees. There's Doctors of Osteopathy, a DO. There's Doctors of Dentistry, DDS. Doctors of Optometry, OD. There are non-medical disciplines, Doctor of Education, Doctor of Philosophy, and Doctor of Psychology. A Doctor of Medicine requires 4 years of medical school after a bachelorette degree, and then an additional 3 to 7 years of residency. You must have a state license and earn CEUs every year. A Doctor of Osteopathy is 4 years of medical school after a bachelorette degree and can work in any specialty area after 2 to 6 additional years of training. You must have a state license and earn CEUs every year as well. Alternative medicine care practitioners. Many carry a title doctor and have specialized training. The CDC estimates that 36% of patients use alternative medicine. Some alternative healthcare practitioners, the Doctor of Chiropractic, pays special attention to the physiological and biochemical aspect of body structure. They adjust and manipulate the spinal column, and they are licensed in all 50 states. A Doctor of Naturopathy, ND. They attempt to remove the underlying cause of a disease and stimulate the natural healing process. Licensed in some states, they may practice independently, unlicensed, or practice under the direction of a medical doctor. Oriental medicine, acupuncture, Chinese herbology, body work, dietary therapy, and exercise. The attempt is to restore the energy flow. Nearly all states regulate the practice of acupuncture and Oriental medicine. The role of the medical assistant. They perform both administrative and clinical functions. They can be receptionist, secretary, office manager, bookkeeper, patient educator, insurance coder, and biller. We draw blood, we do vital signs, we do EKG, we do wound care, and we do histories and physical. We have to maintain positive attitudes. We function under the supervision of the professional and as the communicator and liaison between the physician, the patient, and the hospital staff. Other allied health professionals include health unit coordinators, medical lab technologists, registered dietitians, pharmacists, pharmacy technicians, phlebotomists, physical therapists, physical therapy assistants, and nurses. There's also physician's assistants. They can perform diagnostic, preventative, and therapeutic healthcare services diligently by the supervision of a physician or a surgeon. They may prescribe some medications. They can supervise technicians and medical assistants. They must complete formal education and pass the Physician Assistant's National Certification Examination. With a broad range of competencies in both administrative and clinical areas, the medical assistant are increasingly valued as part of the healthcare team. We need to be great communicators. We serve as liaisons. We are valued as a competent, professional, compassionate medical assistant is immeasurable in today's fast-paced and challenging healthcare environment.
Okay. So, there you go. Now, I hope that everybody has watched through the end of this video, because if you have, you're going to know that there's an extra little assignment. Sorry, my children just came through, but I'm not going to start over. I have an extra little assignment for you. So if you have the 14th edition, I want you to look on page 3, and there's a pink box. It says Critical Thinking Application. If you look on page 19 of the 13th edition, it says Critical Thinking Application 2.2. I want you to do that and submit it. Okay, the one on the 14th edition is Critical Thinking Application 1.1 on page 3. 14th edition is 2.2 on page 19. And I would like for you to submit this. It's just a quick little thing that you need to do. I'd like you to submit this under this heading, please. Thank you. Have a nice day. If you guys have any questions, let me know. Bye-bye.